Welcome to the Megan Claire Show. I'm a cancer survivor, patient advocate, and your host, Megan Claire Chase. I am working with Ancora AI to help share their mission, which is to give unbiased and comprehensive information for patients to empower and bring vetted trial options to all patients. I am thrilled to have Dr. Brian Clemente here today. Dr. Brian is a clinical psychologist with over 20 years experience working with children, adolescents, and adults in a variety of settings in California. He's also an adjunct professor at Pepperdine University. Welcome, Dr. Brian. Hi. So, what the audience doesn't know is Dr. Brian and I knew each other from the college days.
Which was just a few weeks ago.
Right? No time has passed at all.
Not a moment. Not a moment. I thought you were telling the story.
Okay, so, all right. The way we ended up reconnecting is our college, the College of St. Rose in Albany, New York, yay, did a story about me, about my breast cancer story. And during this pandemic, how, I was one of the 40 million that lost my job and insurance. And so they decided to do a story. And lo and behold, it was posted on LinkedIn. And who saw it?
Which is amazing only because I don't participate nor am I active on social media. So it was just a weird fluke that I clicked onto the computer and up pops Megan's face on my screen. I about fell out of my chair.
It was so crazy. And yeah, everyone, we really did know each other in college. So lots of fun memories and reconnecting, and then finding out that, Brian, that you're a psychologist. I love it. It's like full circle. Me as the cancer survivor, and then you as a psychologist, and having to listen to people and help us heal. So how beautiful is that?
Right? Full circle. Here we are.
Yes. So let's talk about creating a toolbox for self-care during the pandemic, because we all know the coronavirus has wreaked havoc over, all of our usual routines. So how has the pandemic affected you and your patients?
I think like everybody, everything is upside down and backward and flip-flopped and 180'd and 360'd in every which direction. So I think the confusion is universal.
Yeah, I agree.
It's a we don't know, but here we go, one day at a time kind of thing, which for a lot of us, we don't do well in that kind of situation. So it's been very bizarre, to put it mildly.
Yeah, but because literally with like no warning, and all of a sudden, there is either a sudden job loss or loss of insurance, or a treatment is delayed, or, now parents are home with their kids 24/7. And I mean, it's just so many heavy things that are happening. Are you finding that your phone is ringing off the hook for appointments?
The funny thing is I think, because of all the adjustments people were making, i.e. working from home, kids at home, everything at home, it was more of everyone was just kind of in it and seeing what was happening. And then it's only been like the past month that I feel like the world has slowly started to spin again, and people's, we'll say, problems that haven't really gone away within the pandemic world all of a sudden have come back, and they're like, crap, all this stuff is still here. So right. Now people have been calling in the past month. My phone has literally been ringing off the hook. It's been a bit insane.
Well, with there being so much stress during these, strange times, and it's really unsettling, quite frankly. Well, what are the top struggles that you're hearing from the people that are needing and wanting help?
The funny, well, not funny, but I guess the challenge has been, from a clinical standpoint, all of the things that we say to do have been taken away from us, depending where you are geographically. In
Right.
California, we're still essentially locked down. So, I mean, everything from, be healthy and go to the gym. No. Go for a walk outside. Parks are closed. No. Go to a movie. No. So, there's been a lot of challenges and challenges to being creative, because you've had to think
Mm,
outside the box. You've had to, that new word pivot, which is the big word. You've had to
yep.
really be like, okay, well, what do I do if I can't go to the gym? Or what do I do if so I've had to really pause and think before I speak, which I don't do well when I'm working clinically, because I have to, okay, here's this person. What do they do? How do we find something to help them relieve the stress, or take a moment to get out of what is this new reality?
Right. That's a really good point of having to think outside of the box, because I am in Georgia, and here everything opened up very, very quickly, and then all of a sudden started closing back down again. So it's just a lot of stress every time you go out, and it's really unhealthy to constantly be indoors 24/7,
Hmm.
um, so what are some of the best tools for self-care during this COVID-19? I mean, and having to, pivot and this forced pause, here in our country, like, what are some tools that we can do in thinking outside of the box that would relate to, everyone right now? What's a universal type of thing we could do?
I think the hardest thing that people, we hear this pivot, we hear all the self-care tips on TV, we hear all of this. So, especially us Americans, we have that go, go, go mentality.
Mm-hmm.
It's counterintuitive, where it's to take that extra moment to check in, to see what it is you need in that moment. And what we don't often think is, I just need to sit here. Because I know for me, I don't sit still well. So some days I'm just like, nope, I know it's a Tuesday, but I'm going to sit right here and I'm going to watch HGTV until I move again. And
Mm-hmm.
a lot of times we don't allow ourselves to do that because it's a Tuesday and we need to get this done. And I've got laundry, and, reality sort of still exists. So it's that, okay, this is different and I'm allowed to do something different that I normally wouldn't do. So we have to kind of manage those expectations of what we accomplish and what we can get done in a day. I breathed today. Woohoo!
Right. And acknowledge that. You really bring up a great point, though, because for me, like, last year, I got really, really sick, and just trying to heal from my whole cancer experience. And I actually had to force myself to just be and sit in silence and be comfortable with the silence. And I think some people may feel that if they're quiet and they actually listen to those thoughts whirling around in their brain, that it'll become too much. It'll be too intense. What do you say if someone says that to you, if they're worried about that?
That's a tough one. You got to do it in small doses,
Mm,
and that's where, yes, if you do sit there and you start to get overwhelmed, this is where you'll hear on TV, do some deep breathing or meditating. If that doesn't work for you, it's okay. You just have to, again, what do I need to do in this moment? I'm overwhelmed. Go for a walk, you know, bake sourdough bread or banana bread, what everyone's baking on the Instagram these days. You know, reach out, do a Zoom conversation with a friend. It's just kind of get through that moment however you can, and then try again later.
I
Yeah.
love that. Really, just taking it moment by moment. And we are really just such a microwave society where we've got to just keep doing stuff and keep going, and where it's actually frowned upon if you just relax and just take a few deep breaths. So I'm really hoping that with the challenges that this pandemic has, caused, that it's also made a lot of us realize, what, life is so fleeting and this time is so fleeting, and really need to force ourselves to slow down a little bit and actually enjoy some of that, or take stock of what we're really thinking and what we really want.
My mom always said growing up, there's a reason for everything and you gotta find the positive. And I think that is hopefully for us universally is this slow down a little bit. One of my favorite memes that I've seen, I'm all about the memes, that's got me through the pandemic, is one of them, it was, I used to, remember when I used to leave the house every day? That seems so excessive.
I love that.
Yeah, and I'm like, oh, I don't ever want to leave the house ever again. Um, but I think the other challenging thing has been the drastic, 1 minute you're like happy and laughing and smiling, the next minute you're like in a pile of tears and you have no idea why. And I think that's we're slowing down, we're trying to figure it out, we're balancing emotions, we're balancing the new routines, we're trying to find a routine. It's all of that. So whatever part of this craziness you're in, it's it's constantly just checking in, deep breath, I'm gonna be okay, positive self-talk, all of that stuff.
So are you doing this for yourself as well?
Yes, I'm trying.
Are you reconnecting with friends and chatting with friends? Maybe
Well,
this friend?
my one friend that I had for many, many, many years. Yes. You try to, well, I live with many, many, many animals. So they're my private therapists. So that's been nice getting to spend time with them. And they really model that just be kind of attitude. So I try to
Mhm.
learn from them since they're so much smarter than us.
I'd have to agree, because I have a cat, Nathan, and it has been great to be able to spend that quality time, especially since he's aging. But also, when I get worked up or when I'm starting to get really stressed out, he feels that, and does his best to, try and calm me down. And he forces me to just stop, you know, because I will not remove that cuteness on my lap, and he knows that. And there's a reason why he's doing that. Um, I know, like, for me, like, my self-care is Zooming with friends. And I've been able to really deepen some friendships where there wasn't a lot of time to do that, because the bulk of my friends are not local. They're all over the world. And so it's been really nice to have those times, and also rekindling old friendships, because there's some time now, and really making that time and realizing, hey, this is important to me. And then I'm reading. I'm actually like almost through with a mystery. Like, I'm taking that time. Sometimes it can be hard to focus,
Like a book?
but yeah, I love to turn the page. I don't like to scroll. I'd love to turn the page,
No, I'm
but
old school like that too.
you know, but I
Well,
think it's, yeah.
the cool thing about the Zoom, I think, is that in the day to day, when you check in with friends, especially old friends, you're like, you catch up. It's very, I don't want to say superficial, but for the sake of the conversation, it's, you can only cover so much in the brief time you have. But now, even over Zoom, there's the space to say, how are you? And actually dive into, you know what? I'm not great.
Right.
Today's been a rough day. And normally we would never go there and do that.
Hmm.
But people have been You know, like I call out my friends. I'm like, really? You're doing great? You look great. So I think that's really nice that we've been able to, you know, again, have that space to be supportive and be open to checking in with people beyond the superficial. Oh, how are you? Your hair looks
Yeah.
nice, Megan Claire.
And the fact that people actually want to know, you know, because sometimes it's like, oh, how are you? Okay, great, you know, and then they just go on, and you're right, it really is like it's deliberate this time, like, no, really, talk to me. How are you? So that's a really good point. That's why you're the psychologist. You kind of know what you're talking about.
Some days, I have my moments.
Well, as we wrap up, Dr. Brian, I'd love for you to offer some encouragement to those patients and, you know, caregivers, physicians, people everywhere, you know, who are just struggling during this pandemic. What are some encouraging words that you could say to just bring a little bit of comfort?
I think, you know, I'm not one to reinvent the wheel. So I think the classics, that this too shall pass, and it's okay to not be okay. You
Yeah.
know, those are timeless, that are really resonating and couldn't be more true in these times. You know, so this too shall pass, the moment, this whole pandemic, hopefully, everything. And it's okay not to be okay, and it's okay to give yourself a break.
And then it's okay to ask for help
Yes.
and get that help, right?
Yes. Yes.
So, well, thank you so much for joining me today, and everyone, the audience, thank you. And you have not seen the last of Dr. Brian. Oh no, because next time Dr. Brian and I talk, we're going to discuss clinical trial phases and what that all means, right? So until
Sounds
then,
exciting.
right? I know, you can't wait to dive into that. We're going to break down
Yes.
these clinical trial phases so we actually understand what it means. So in between that time, make sure you check out the resources on Ancora AI, like their FAQ list or their blogs. You may see some blogs written by moi, Megan Claire, by going to ancora.ai, where they humanize clinical trials. So I am Megan Claire Chase, and remember, the more you know, the more empowered you will be.